gonna be your nurse today. I'm just gonna do some hand hygiene, and then I'm just checking the order for an NG tube, and we do have one. Can you tell me your name and your birthday? Okay, good. And then do you have any allergies? Okay. And then I am going to check the patient's wristband. Make sure they are who they say they are, and they are. And we're just gonna get all set up. I don't see a tissue, but I would just offer the patient a tissue. That way, if they need one during this, they can have one. Okay, and I'm just gonna get everything kind of ready. So. Go ahead and measure the tubing. And we just start at the nose, tip of the nose, go to the ear, and then you stop at the indent right under the chest. So you're just gonna stop at their, oh gosh, why can't I remember what it's called? Just gonna stop right there in that little divot. And then I'm just gonna add a little bit onto the end. There's others. Okay, and I'm just gonna mark it. Tape here. Oop. Okay. And then I'm just gonna set my patient up just a little bit more here before we start. So you just kind of want them to have 45-degree angle. Okay, and then I'm gonna go ahead and get my lube ready. Gosh, maybe. Can you see it okay? Okay, and then I'm just gonna stick that in the tip. And then I'm gonna give my patient some water just to drink as we insert that. And then, which nose can you breathe better out of? Which nostril? Your left one? Okay. So we'll go ahead and do that. And then I'm just gonna tip the patients, have them tip their head back when we first start inserting. And I'm just gonna gently twist. Okay, this is gonna be kind of uncomfortable, so just make sure you're sipping on some water. I'm just gonna slowly insert, and then once we hit the back of the throat, I'm gonna ask the patient to tip their head forward. So go ahead and tip your head forward. So I'm gonna have him hold his head forward so we can get past that, and we're just gonna slowly insert the tube. And we want them to keep drinking water. So if they started gagging or coughing, we would just stop for a second, have them kind of calm down. We don't want to pull the tube out because we just have to start again. So we're just slowly gonna insert until the mark. Making sure we're not forcing. Maybe we're. We kind of hit this rough spot, so we're just gonna try to twist it in there. Okay, that is as far as the tube wants to go, so we're gonna go ahead and tape it off. Okay, so we're just gonna do a small piece of tape just to kind of hold it in place for now. And then we'll go back in, do the wraparound piece if it will stick to his nose. Okay, so I'm gonna go ahead and we're just gonna aspirate some stomach contents to check that it's in place. So we would also, go ahead and make sure that the patient has an x-ray to make sure that it's in place. Good grief, why is this having such a hard time? Okay. So we'd also make sure they do an x-ray. So that's our best way to check that it's in place. And then we're just gonna aspirate 10 mLs of stomach content. Okay. And then I'm gonna go ahead and plug the tube off. And then I just squirt it into this cup and go ahead and check with a pH strip and make sure that it's correct. So this is just testing to see that the pH is correct and it's in the stomach. Okay, and it looks like it's correct. So it means we're in the right place. We didn't go into anywhere else. Go ahead and take that away. Okay, so I'm just gonna go ahead and tape them up real quick. Okay. And then I'm gonna go ahead and just secure it to the gown. Well, let's take my coat. Okay, so I'm just gonna close them up. And then are you in any pain or discomfort? No? Okay, that's good. And then I'm just gonna take my clothes off and perform hand hygiene. And now we'll go ahead and tape that to the gown. That will dry. And so we want to have the patient turn their head away. So I'm just gonna have turn his head away. And you just kind of want it to be loose so that they're not gonna tug on it. Okay, so we would do right about there. Alrighty. Okay. Secure that. All right, and then again, we just leave the patient with a tissue, make sure that's stopped off, and then I would just check my patient and make sure that they're not uncomfortable and that that's feeling okay. And then again, we would just check the x-ray and make sure that it's in the right spot.